New at 10 tonight, urgent care can be an important resource for people with serious medical needs that may not need to take up space at an emergency room.
But some patients in Tucson tell the News4 Tucson investigators they feel the level of care they receive was less than urgent. And our chief investigative reporter, Corson Nylander, searches for answers in tonight's News4 Tucson investigation.
Well, urgency is in the name, but a Tucson man tells me not once but twice when he showed up to a local urgent care, he was shocked to find that there were no medical providers on site.
If you don't have the resources to run an urgent care, why is it even here and why is it open?
Aaron Pickering is frustrated after two recent visits to two different NextCare urgent care locations had him seeing a medical provider over the phone instead of in person.
And when we arrived, they informed me that they don't really have any person here to treat me. There's no practitioner. And so they said, well, we can switch you to a virtual visit, which was a little odd to me because, I mean, we just walked into an urgent care.
It happened at this location on Tucson's south side in October, and then again when he stopped into the location here in Green Valley the end of December. He found the virtual sessions unreliable.
The Wi-Fi was not very good. It kept dropping, so the virtual visit was even very difficult to do.
The News4 Tucson investigators reached out to NextCare, which sent us a statement reading in part, quote, "While we fully staff our clinics with providers, periodically emergencies, such as provider illness, do arise and the scheduled provider may not be available to be in the clinic. We always try to send an alternate provider to the clinic in these situations, but if one is not available, we offer a telehealth option when medically appropriate instead of closing the clinic. During a telehealth visit, the local staff supports the patient with any needs along the way. They're able to triage the patient, take their vitals, gather additional information the provider needs, and facilitate any tests or labs that are indicated. Patients always have a choice. If they prefer not to see a virtual provider, they can always go to the next closest NextCare clinic or another urgent care provider for service." The News4 Tucson investigators spoke to other urgent cares in the area. Everyone we spoke to said they will always have an on-site provider to have a location open, but feel virtual visits can be a valuable tool to offer options for patients.
If somebody's going to an urgent care, they're thinking that they're going to be seen by a healthcare professional. Otherwise, they would have just done telemedicine from their comfort of their own home.
Dana Marie Kennedy, director of AARP Arizona, says she is concerned for elderly patients who may not be as savvy with the new technology. AARP actually has worked to encourage seniors to take advantage of telehealth options. Data from AARP shows that only 13% of people over the age of 50 are using the technology to help with their medical needs.
Not all seniors are comfortable with telemedicine, and sometimes it can definitely provide a great quick, answer. Sometimes a prescription medication is what is needed, and that's why they do telemedicine. But if you go to urgent care, you think that you're actually going to be seen by a trained professional.
Aaron says he saw firsthand seniors struggling.
One lady, hard of hearing, she was trying to explain what she needed, and they were trying to explain to her that, you need to use your device, and she's, in her 80s, and she doesn't understand what they're trying to tell her.
He believes if a medical provider isn't on site, the location should be closed to avoid confusion.
Really defeats the purpose, in my opinion, of having an urgent care.
And we have NextCare's full statement you can read for yourself over on our website, KVOA.com. Reporting from the south side, Corson Nylander, News4 Tucson.